I'm Dr. Vaishak, consultant physician at Indiana Hospital, Wakel. And today I will be discussing about hypertension, lifestyle, and medications. Now, just a brief talk on the subject. And now, what is hypertension? Now, generally, when we measure the blood pressure, we're calculating the speed at which the blood flows through the veins. And what we define hypertension as in the latest guidelines, guidelines have kept changing over the years. And the latest guidelines, when you have a blood pressure of more than 140 systolic by 90 diastolic, that is termed as hypertension. And we again categorize them based on different patients, and we have different guidelines for the control for each patient. And based on the BP, we classify them into stage 1, stage 2, stage 3, where stage 3 is the highest of the BP categories. Now, what we achieve by these terms is to maintain a set level of BP, and especially in patients with diabetes, we have to, and patients with chronic kidney disease, we want to achieve a higher control of blood pressure. Now, the main question which most people come to us is whether we have to take medications or can we control blood pressure with our lifestyle changes. Now, again, here this varies from patient to patient. Now, for most people, initially, definitely lifestyle modification does help, and again, it has no side effects. Now, what do you modify in your lifestyle to control your blood pressure? Mainly, first and foremost, diet. Now, in all patients, again, what we do define as a DASH diet is generally prescribed for hypertensive patients. Here, you have patients are advised to take a high amount of vegetables and fruits. Vegetables and fruits, all vegetables and fruits, definitely inculcating in your diet helps regulating your blood pressure over a long period of time. You should ideally try to include white meat is recommended. White meat, that is chicken, is recommended, and red meat is not advised for controlling blood pressure. You should include a higher amount of proteins, legumes, cereals, and nuts in your diet. Again, try to restrict your salt intake to the maximum, which again, all sorts of salts, pickled foods, processed foods, you reduce your intake of carbohydrates, that is your rice and sugar to maximum. And again, all this will go a long way in regulating your blood pressure. Second, again, is exercise. Important for controlling all sorts of diseases. Again, over a longer period of time, at least maintaining a 150 minutes per week of exercise is recommended for all patients. It's not only for patients, for anyone, in fact, and goes a long way in controlling your blood pressure. That is, these are the main two things we have to see. Third is regulating your daily stress. Many people come to us with no family history or maintaining adequate exercise and diet. In fact, still your blood pressure is not controlled. In such patients, when you take a deeper history, they're too much engrossed in their work, have less sleep, and reduced sleep is a very important cause of hypertension. Such people, once they are able to maintain about 6 to 7 hours of sleep a day, your blood pressure normally comes down to a great extent. Now, in spite of all these efforts, if your blood pressure is still not getting controlled, or if you have a family history of, say, stroke, cardiovascular disease, anything of such sort, such people definitely should take medications and you should always follow the advice of your doctor. Medications, again, come with certain side effects, but based on each patient, we taper and control the doses. And again, along with the set medication, lifestyle control, definitely will help in reducing your blood pressure. And I think that's all. Thank you for your patient hearing.